Hello, welcome to MD Caregiving, your family caregiver training resource, where we provide instructional videos on family caregiver training and the common and safe use of home medical equipment. This video will focus on assisting persons with bathing transfers whom are having difficulty due to hip replacement. The emphasis will be on the use of a transfer bench. A transfer bench is an elongated shower seat that straddles the tub threshold, providing ease and safety for tub transfers. Additionally, during hip replacement recovery, there are commonly hip restrictions or precautions. The most common of these are do not bend at the waist past 90 degrees, do not cross your legs, or turn the involved leg inward. To set up the transfer bench, inspect it for stability and proper functioning. Inspect the height adjustment buttons, rubber feet condition, screw tightness, and make sure the seat and backrest are void for sharp or rough edges. Place the transfer bench into the tub stall with 2 legs inside the stall and the other 2 legs outside. Adjust the transfer bench for proper height and levelness, adjusting each leg individually to accommodate the convex nature of the tub. When seated, a person's hips should be slightly above their knees. The handle on the bench must be along the inside wall, and the transfer bench should be placed back towards the rear wall so a seated person will have sufficient leg room to complete the transfer comfortably.
When the person being assisted is able to stand, position the wheelchair just behind the transfer bench, with the corners touching. Lock the brakes, then swivel the wheels away to a rear-facing position. Have the person being assisted stretch out their involved leg, maintaining a greater than 90-degree hip-to-trunk angle, utilizing the armrest, looking up, and provide assistance to slowly stand. Once stable, have them turn, putting the back of both knees against the transfer bench. Have them take a half a step forward to relax their involved side, holding on to the wheelchair armrest, then provide assistance to slowly reach back and sit down on the transfer bench. Once stable, the wheelchair can be removed out of the way. With both hands on the bathing board, provide assistance for them to slowly turn towards the tub. Then provide assistance to raise their first leg over the tub threshold, maintaining a greater than 90-degree hip-to-trunk angle. Have them continue to scoot towards the tub on the transfer bench, then provide assistance to slowly raise their involved leg over the tub threshold, maintaining a greater than 90-degree hip-to-trunk angle. They can reposition as needed for comfort. When the person being assisted is unable to stand, position the wheelchair next to the transfer bench. Remove the armrest closest to the tub, lock the brakes, and swing the wheels around to a rear-facing position. Have them place their hand closest to the tub onto the transfer bench, the other hand securely on the wheelchair seat or armrest. Then provide assistance for them to raise up and sit onto the transfer bench. This may take a few attempts. As they continue to scoot onto the transfer bench, provide assistance for them to maintain stability and safety. Once stabilized, the wheelchair can be removed. Have them carefully raise their first leg over the tub threshold, utilizing both hands to turn and reposition as needed. Then carefully raise their involved leg over the tub threshold, continuing to scoot into the tub. Make sure to maintain a greater than 90-degree hip-to-trunk angle.
Congratulations on your purchase of our instructional video for bathing transfers, and I'm sure you are now a more confident caregiver. MD Caregiving cautions you to review our videos prior to providing any caregiver skills assistance, as bathing transfers can be difficult and potentially dangerous. Thank you for selecting MD Caregiving as your family caregiver training resource.